This conference will now be recorded.
Okay, Margo, go ahead. Oops, we don't have Margo. We need to hold on for just a second. Hi, everybody. This is Nicole Clement at TASK. Just bear with me for a second while we work out one tiny little technical glitch. We'll get started in just a minute. Okay, Margo, are you with us now? Please press *2 to unmute your line.
Hi, it's Margo. Can everybody hear me?
I hear you.
Okay, great. Thank you. I was dialed into the wrong number first, so I apologize. Just got here. So welcome, everybody. I see we have about 8 people on the line today, a slightly smaller crowd. We'll just get started. Maybe a few more will join us. So this is our third and final cohort call on the Framing Rural Health Value webinar series. Our cohort discussion today is about processes for improved financial and quality outcomes and data measurement outcomes and impact. So today's learning objectives, discussion of application exercise number 3, and that's application of critical success factors related to process improvement for financial and quality outcomes and data measurement outcomes and impact to the case study Critical Access Hospital. Participant sharing of critical access hospital examples in your states, either in need of or having received support for process improvement for financial and quality outcomes and data measurement outcomes and impact. So by now you know the drill, kind of the same thing as we've been doing the past 2 cohort calls. We will talk about those critical success factors and which ones you chose and why. And then please feel free to jump in and share examples from your state, ask questions of each other, that sort of thing. Another learning objective today, develop group recommendations for the case study as we have been doing. We're taking notes on all these calls to develop some group recommendations for this critical access hospital case study. And today it's regarding process improvement for financial and quality outcomes, once again, and data measurement outcomes and impact. So our agenda, as usual, Just wanted to welcome everybody, review of Performance Excellence Framework so we can see where we are and where we've come with that, review of the case study, and discussion of those application exercises. So here's our Performance Excellence Framework. We've gone through, I believe, all of these now, and so we're going to move ahead and take a look at what you guys chose for this week's applied exercise. Okay, so looks like the most points went to providing or arranging for direct technical assistance to Critical Access Hospital via technical experts on finances, business processes, quality of care, and patient satisfaction. So that one stood out with 18 points. I would appreciate it if someone would jump in, anyone who voted for that one, who gave that one some points, tell us why you feel that's important and any experience that you have with that or any questions or comments about this particular item. It's *2, again, to unmute your line. Nicole, do we have everyone on the right phone number now?
I see 9 people on the line.
Okay, great. I don't like calling on people, so somebody jump in and let me know if you gave this one points and just tell us a brief explanation why you feel this is important for this Critical Access Hospital. *2 to unmute.
This is Corey in Oklahoma.
Hi, Corey.
Hello. I think that one is important because it addresses a lot of the issues, not only with the finance side, but also with the quality of care, the clinical care within the hospital, and then it will also address the leadership and board issues that the hospital's been experiencing. So it's kind of a full circle approach to the types of assistance that the Critical Access Hospital needs, from kind of the top down to the patient care.
Right, closely related to the things we've been talking about over the last several weeks.
Mm-hmm.
Okay, thank you.
You're welcome.
Anyone else want to comment on this one? Does anyone else have examples or stories from your state relating to this?
This is Greg in Utah. Can you hear me okay?
I can. Hi, Greg.
Hi. You know, every time I read the story about this hospital, there's not very many areas that they don't have pretty severe problems.
Right.
And so my feeling has always been with the hospital in this kind of a situation that the cash flow is critical just to keep things afloat while they work on longer term goals. We had, I think I've mentioned, we had a hospital like this in Utah, and one of the first things that we did was we retained a revenue cycle improvement management team to go to the hospital, and they spent a whole week there just going through all the revenue cycle operations, coming up with immediate recommendations like the charge master and different things that would help them improve their cash flow to stay afloat.
Okay. Thank you for sharing that. Anyone else have stories or comments about this one? I'll wait just a bit longer in case someone's trying to figure out how to unmute. It's *2 to unmute. Okay, if not, we'll move on. The next one, receiving 13 points, was using a systems framework. And Baldridge would be one example of that, to manage information and strategic knowledge. So we've been talking a lot about using a systems framework.
Hi, Margo. This is Crystal Barter with the Michigan Center for Rural Health.
Hi.
Hi. I gave a majority of my points to using a systems framework to manage information and strategic knowledge because I just feel like if the hospital operates continuously utilizing the strategic framework and it's embedded into their culture, they're probably going to be more likely to recognize the problems that were listed in the case study and know how to address them. But also, I gave it a majority of points because I felt like that using the system framework was kind of like an overarching step or the foundation that would lead to the other interventions that were listed.
Wow, very good point. Thank you. Yeah, it's like big picture thinking. If we've got the systems framework in place, we're prepared to hopefully to handle whatever might come our way.
Yeah, and a lot of these other interventions might be outcomes based on the systems framework.
Sure. Okay, thank you. Very good point. Who else has comments about using a systems framework? Does anyone feel it's not important to use a systems framework?
Yeah. Margo, this is Larry.
Hi.
I also gave the majority of my points to this one. A lot of times, we'll go in and maybe do an intervention with the hospital, but it's not always continued. So I think by them having a systems framework in place, it gives it a little bit better opportunity for long-term success.
Sure, I agree. Thank you. Does everyone else agree with that, or does anyone have any counterpoints? Any other comments about systems frameworks? Any experience that you have with using systems frameworks?
Hi, Margo. This is Crystal Barter with the Michigan Center for Rural Health. I think it would be interesting from a state office perspective to hear if anyone else uses any sort of system framework within their office. I know that you guys do at TASC, but I don't know of any other state offices that do.
Okay. Anyone else on the line that uses a systems framework or is thinking about it or has a response to her question?
That's okay, too. Just wondering.
Okay. And, if we don't have anyone on the line that responds to that question, you could certainly pose that on the Flex Forum, too, to reach everyone across the country and get some input from them.
Okay. Thank you.
Sure. Yeah, that was a good question. I'd actually like to know that, too. Any other questions or comments or stories on systems frameworks before we move on?
This is Greg in Utah again. I guess the question I have about the systems framework is when we've implemented that or encouraged participation with the hospitals in Utah, we noticed that it takes a while to get that up and running. Many months for them to understand the concepts, start their process improvement projects. So I'd be curious if anybody's had experience that that's moved along quickly. In a hospital like this one that we're discussing, I see that as more of a long-term solution, but more immediate interventions would be needed. Unless others have had the experience with this systems framework can be up and running pretty quick.
Right. Thank you. That's a very good point, too. With a hospital in this dire of a situation as they seem to be, I'm sure starting a systems framework is difficult to get up and running quickly and maybe more important to put out the fires first. That's a good point. Anyone else have comments on that? It would have been ideal if they had implemented that a while ago. I know there are some others on the line who haven't spoken up yet, so if anyone has comments on systems framework, please speak now or we'll move on. *2 to unmute. Okay, how about if we look at the next one? Closely behind with 12 points was developing efficient business process with a particular focus on revenue cycle management. Anyone who gave this particular item some points, would you like to talk more about that?
Margo, this is Greg. That's the one that I mentioned previously. I put quite a few points to that. Just, again, the thinking being that they've got to maintain some type of cash flow to keep going while they're working on other interventions and improvements. And that's when we had the revenue cycle team come into this critical access hospital in Utah and kind of stabilized cash flow is the first thing.
Sure. And how long ago was that? Do you have more information to tell us about how that worked for them?
You know, it certainly accomplished the objective. It was probably 3-4 months ago that we did that, and this is also the hospital where we had a CEO mentor come in. It wasn't the only intervention, but proved to be one of the first ones we did to kind of stabilize things, and it's now been 3-4 months out, and they have cash reserves where they can now focus on things like physician recruitment and some other burning issues.
Okay. So it sounds like you're seeing some success with the strategies you've implemented there.
Yeah, so far so good.
Moving in the right direction at least. That's great to hear.
This
Who else
is Joel.
wants to comment on
I
this?
would agree with Greg's points as to the most of the need in that area, more pressing and exigent than other areas.
Sure. Thank you for chiming in. Anyone else have comments on this one? Questions, stories? How about if we take a look at the next one then? Developing a workforce that is change ready and adaptable. That's something that we've been hearing and talking a lot about. And then for some examples there, it says you might implement Baldrige, Lean, Studer, the ARC culture of patient safety, or team steps. I know there are some of you out there who have to have experience with some of these, and if you'd like to share, that would be great. Let us know any barriers or successes, lessons learned. I think developing a workforce that is change ready and adaptable is another thing that doesn't happen overnight. It's going to take some time. If someone would share any experience that you have with this, I would appreciate it. Or chime in and let us know why you chose this one, why you feel it's important. I think we have a couple people from the Office of Rural Health Policy on the line. I would like to invite you to jump in at any time as well. Feel free to contribute your comments and questions. Anyone who's used any of these, Baldrige, Lean, Studer, Team Steps? Just let us know how it went. Anything you learned from it? If not, we'll move on. Let's look at exploring partnerships with larger systems or rural health networks. Facilitating network activities, care transitions, and data sharing. I think we talked about this. I don't remember if it was on this call or maybe a different one of the other cohorts the last time around. Are your critical access hospitals open to exploring those partnerships with larger systems and networks?
Hi, Margo. This is Crystal Barter with the Michigan Center for Rural Health. I gave some points to this one just because we have a couple networks both on the financial side and the quality side for our hospitals, and they've just been extremely valuable. I think that the networking, the data sharing, everything that comes with being in a partnership is really valuable, and they've found everyone's improved by joining the network. So
Great, thank you.
Yep.
Others, have you had the same experience or different experiences with that?
This is Greg, the Utah Flex Coordinator. About 2 years ago, we approached the 9 rural independent hospitals in the state of Utah about the possibility of forming a network. They were all interested in that. We actually formed a not-for-profit organization for them. They're paying dues, and we've implemented several projects and programs where they come to the table as a group of hospitals versus each one of them trying to do it individually. And I think by all of our measurements, it's been a really good thing, not only to get better pricing and better terms for services, but just to give them an opportunity to collaborate and share best practices. We've started the CEOs meet regularly. We've got the CFOs meeting, the chief nursing officers, and then we just started with the quality improvement coordinators. So one of our concerns at the very beginning was, is 9 hospitals enough to really make a difference? We didn't know if we had a critical mass, but it's turned out that it is. The vendors are very interested when you bring 9 or fewer hospitals to the table.
Okay. And you mentioned they pay dues, so then they must feel that the dues they pay are worth it as far as the benefits they get out of doing this?
Yeah, so far they're happy to put those dues in. It's not a lot, but it just kind of develops a fund for us to start projects and do different things where we need some resources.
Okay, great. Thanks for sharing that. Anyone else with comments about this one? Partnerships and networks. I know that's kind of a hot topic, so anyone else want to share their stories or speak to this item?
Hi, yes, this is Angelica, coordinator for California.
Hi.
Hi, and in California we do have a network, and it's similar to what the gentleman before discussed, where the members do have a monthly fee that they have to pay, but being part of the network, it provides enormous benefits to them, where they are, there's a group purchasing elements to it that really help the hospitals. And just, I want to say within the last year or so, there was a CFO group that came about. And so the same CEOs that participate in the network, their CFOs participate in a meeting where they get to discuss finances, best practices, and so forth. So you know, a network, being part of the network is definitely something advantageous for the hospitals.
Okay, good. Thank you for sharing that. Any drawbacks that you've seen, either you, Angelica, or anyone else, or any
you know what because to be part of this network, you do have to have you have to pay the membership fees. There has been a few hospitals who could not afford to pay it at one time or another.
Okay.
So I mean, that could be a plus or a negative.
Okay. Who else has comments on this particular item?
Margo, this is Larry. We also have one here in Pennsylvania, and probably the most recent benefit from it has been in the information technology area. And they have, for instance, I know, gone out and met with the people at SISU, you know, creating a network or trying to create a network similar to them. Certainly, they're probably the gold standard out there. If you want to fill people in on what that network does for you in Minnesota, that would be great. But they've tried to emulate that network, and I think that's been a benefit to some of our rural hospitals here in Pennsylvania.
Okay. Sure, it's good to have a good example to follow. Others with ideas about this? Okay, we can move on to the next one, gathering and using data to improve health and safety of patients in the service area. This one had 5 points. Obviously, we talk a lot about gathering data, and then once we have it, how do we use it? So who gave this points and why? Or who has some experience to share with this? Gathering and using data to improve health and safety of patients in the service area. Star 2 to unmute. Someone gave it 5 points. I see Nicole just entered into the chat box the website for SISU that Larry just mentioned. Thank you, Nicole. Okay, if no one wants to talk about that, let's move on to aligning with primary care providers to develop a common vision, goals, and initiatives focused on creating value. That one also got 5 points. Does anyone want to make a comment about that? Aligning with primary care providers.
Margo, this is Larry. I was at one of our critical access hospitals yesterday for a day-long strategic planning meeting, and this one in particular has risen to the top of their list. They have a primary care practice in the area that's being recruited away from them, or at least their patients are being recruited away from them by one of the large systems about 20 miles away from them. So a lot of their strategy is going to be around bringing this primary care group back in and closer to the, or let's say closer business-wise to the critical access hospital. So, you know, a lot of our hospitals, if they lose 1 or 2 physicians, it can make a big impact on their bottom line, and that certainly has happened to this particular hospital.
Okay. That's a good example.
This is Joel
Thank
from
you.
Florida. I assigned this just 2 points, but that was pretty much the reason what Larry just said. I mean, obviously the cause is so reliant on such a small number of practitioners.
Right. Okay. Anyone else have anything to say about that one? How about evaluating strategic progress regularly and sharing information organization-wide? 4 points went to that one. I would agree that one is important. Always be evaluating progress and always share it with everyone in the organization. Try to keep everyone on the same page. Although I can understand why it may not be at the top of the list because there's a lot of fires to put out with this particular hospital. It's a good overarching goal, Any comments? Stories? How about conducting hospital economic impact assessment? That one had 4 points. Why would that be important?
Hi, this is Angie from North Dakota. Can you hear me?
I can. Hi, Angie.
Hi there. Say, I didn't put this conducting hospital economic impact assessments. I didn't rate this as one of mine for this assignment. However, our FLEX program does sometimes support these assessments, and we think it's great. A question I had about them, so maybe for whoever did assign points to this, is my question is, we do them, but we're not always sure that we are sharing this information in all the ways that we possibly could, as widely as we could, and so we are now starting to request some deliverables of these assessments that we support, and that includes press releases, links on hospital website, sharing it with the hospital board and foundation, city and county government, local economic, job development, business, things like that. Does anyone on the call have other ideas for ways we could maybe be getting this information out more and better?
Good question. Thanks, Angie. Does anyone have an answer for her? Star 2 to unmute your line if you have an answer or comment for Angie. If no one does, Angie, I would say, again, that would be a good question to put on the Flex forum and ask everyone across the country if they have some feedback on that.
Sure, I think I'll do that. Thanks, Nicole.
Sure, this is Margo.
Oh, sorry. Yes. Thanks, Margo.
That's okay. Okay. If no one else has comments or questions on that one, we can move on to continually improving quality and patient safety processes. 3 points went there. I guess that's a little bit of a no-brainer. Does anyone have comments, questions, stories on continually improving quality and patient safety processes?
Well, considering it's a no-brainer, those are my 3 points, so I'm perfect for something that fits that description.
Okay.
It's just kind of self-evident.
Right.
I guess when I put the 3 points on that, I really didn't pay enough attention probably to the one that received the most points, or I might have just as well assigned it to that one.
Oh, okay. All right, thank you for sharing that. How about the next one, supporting the critical access hospital in a multi-hospital or network quality project focused on data measurement or benchmarking? That one had 3 points. Why might that be important? Quality project focused on data measurement, benchmarking.
Hi, Margo. This is Crystal. I didn't assign points to this one, but I do think that it falls under using a systems framework, and it also could fall under participating with rural health networks. So it is very important, but I think maybe the reason that it didn't get a lot of points was that it might fall under some other categories.
Sure. Very good point. Thank you. How about supporting performance excellence training for the hospital staff? That one had 3 points. questions or comments?
This is Joel from Florida. I assigned one of the three, simply thinking it's a very good system, a very clearly understood, one that would probably be a little easier to implement. I'm thinking in terms of timeliness than perhaps some of the other systems.
Okay. I hear you. I see that point. Thank you. Anyone else have thoughts on that one? Okay, how about publicly reporting and communicating outcomes broadly? 1 point went there. Anyone have a comment there? Documenting value in terms of cost, efficiency, quality, satisfaction, and population health. Comments? Questions?
Margo, this is Larry. I did assign one with an asterisk to the publicly reporting and communicating outcomes broadly once they are where they should be, because this hospital had a reputation that maybe wasn't as stellar as it should be. So once you get it up there, then, I think it's time to talk about it and use that out there for your community to let them know that you are doing well. So.
Sure, very good point.
Hey, Margo, this is Nicole.
Yes.
Kind of getting to the point Larry just made, I was reading something in my inbox yesterday from one of the Fierce newsletters. I don't know, you guys probably get those. And they were talking about an Iowa critical access hospital they've managed to get a surgeon from a bigger hospital to come in and do bariatric surgery. They've made a $20 million investment in a surgical suite for these bariatric surgeries. And then the author of the article went on to warn people about being careful going to that hospital because they don't report their quality data to Hospital Compare or anywhere else where people can view it. So the author made it sound a little bit questionable about the culture of safety in that hospital simply because they don't report their data. I thought that was so interesting.
Oh, wow. Yeah, very interesting. Important to be transparent. Anyone else have thoughts, questions on that one, stories? Thank you, Nicole. Okay, if not, let's see, what else do we have? Documenting value in terms of cost, efficiency, quality, satisfaction, and population health. Supporting critical access hospital and multi-hospital or network quality project focused on financial and or quality improvement. Providing critical access hospital leadership, development, and management education support to improve overall CA performance. So those all had 1 point. Anyone want to speak to those? Otherwise,
This is Joel again in Florida. I didn't assign any points to either of those, but like many of the other items, I see a lot of value in it.
Right. I wanted to scroll down. I know there were a few comments, and I don't think that either of the people who made these comments are on the line today. One said the hospital can really benefit by working with other hospitals on gathering and utilizing data. It is much easier to collect data than it is to analyze it, so they need the expertise of others to tell them where they are at and guide them on next steps. The management and staff will need some sort of system, such as Studer or Baldridge, so they can make and measure meaningful improvement. And then there was another comment, just like at Moab Regional Hospital in Utah, the most important thing to do first is to bring in fresh eyes, aka consulting expertise, to assess current practices and develop an efficient strategy for improvement. This will also help to benchmark progress from a clear starting point as map the way to success. Next step would be to realign the workforce with Lean, Baldridge, or Studer to be more adaptable, team-oriented, focused, and effective. Anyone want to comment?
This is Greg in Utah. That Moab Regional Hospital is one of the critical access hospitals that we worked with in Utah. What we did on that particular hospital is we had an experienced CFO working in another CAH hospital that I talked to, and he was willing to go down to that hospital and spend some time on the ground reviewing their revenue cycle type operations. And I think that's what's being referred to as bring in fresh eyes, somebody who's, hasn't been there and can come in and look at things from a different perspective and make some suggestions that weren't on the forefront of what they were doing. So that was very helpful in that particular case in Utah.
Okay, thanks for sharing that. So at this point, we have a little time left. I can maybe open it up if anyone wants to share stories about anything we've talked about today or anything we missed today. If you have questions for each other, best practices to share, any comments, questions, anything else you'd like to talk about today? Any resources you want to share? It's *2 to unmute, so I'll give you just a little more time in case there's anyone trying to figure out how to be heard. *2. Okay, hearing nothing, I will wrap it up just a little bit early today. This was our final cohort call, so we've held 3 of them now, and we'll be putting together the notes and the recommendations. The final event will be our webinar series wrap-up, and that's coming up on